Good morning, everyone. It's good to have a press conference at 7:30 in the morning when we haven't stayed up all night working on logistics for another case. And this is somewhat of a happy press conference for us, because today we are able to announce that of the original 48 contacts, 43 of those contacts have effectively rolled off and are Ebola-free as of midnight last night. There is one person who will roll off a little later this morning due to the time that they rode in an ambulance before it was taken out of service that Mr. Duncan rode in. There are 4 more people who were healthcare workers who saw Mr. Duncan on the 28th and continued to have contact with him after that time for some time. They'll be rolling off a little later. But all of those 48 are well into, 43 are off, and the one will be later today, and the other 4 will be in the coming days. So that is very good news. I want to take you back to that aspect of this fight against Ebola. Mr. Duncan began exhibiting symptoms either on the 23rd or the 24th. He was not placed in isolation until the 28th. The disease detectives, and there are 9 of those with Dallas County Health and Human Services, had to go out into the community immediately, even before the EPA teams from the federal government got here, and began doing a contact tracing and find the right people. Because had they missed someone, and we had had a person who wasn't monitored and had been out in the community for 4 or 5 days with another Ebola case, then this would have multiplied. The World Health Organization tells us that for each Ebola case that is treated, 2 more come up. And that's what we're seeing right now here, even with American medicine. So the worry for all of us was that due to the fact that Mr. Duncan was out in the community for a time, that we would have a lot of disease contacts. Well, they were able to find those 48. I will tell you, I can remember Mayor Rawlings and I meeting an epidemiologist in a parking lot named Emily, one of our Dallas County epidemiologists, and along with some first responders searching for a person who lacks a home, who's now, or up until yesterday when he rolled off the list, was a guest of the county and the city, and for that matter, Presbyterian Hospital. They really did just some tremendous work, and they're doing some tremendous tracing work. I wanted to bring them up here to kind of praise them, because they are all young people. They're all pretty new from out of school, both at the county and the state and the feds, and they've worked just so incredibly hard. They've declined to be on camera. They're afraid it might interfere with their disease tracing work. But I've got a statement from one of them about the Tro family, and let me read that to you real quick. When our contact tracing began, working with Mr. Duncan's family and friends, they were understandably going through a very difficult time, full of fear and uncertainty. However, throughout this monitoring period, this family has been nothing but cooperative and gracious. We were able to support them through difficult times and celebrate with them on the day they had been waiting for. It was a pleasure to not only to be let into these families' homes, but also to be let into their lives. We understand this has been a very trying time for the families, but we wish them all the best moving forward. We've got our state and federal partners here with us this morning as well, and I'm going to introduce all of them. But before I do, I want to talk about the 5 children that will be returning to school, and I want to ask for the community's help. I'm sure Mike Miles will will speak to this as well. These people, part of our community, are integrating back into our community. And I talked to Louise last night on the phone, and her feeling for this morning was one of fear. Fear of how she and the young men would be accepted, of how they would be treated, of whether they would be seen as disease carriers or oddities. There's zero risk that any of those people who have been marked off the list have Ebola. They were in contact with a person who had Ebola, and the time period for them to get Ebola has lapsed. It is over. So they do not have Ebola. They are people who've been through an incredible ordeal, and they are people who need our compassion, our respect, and our love. Treat them the way you would want your own family treated if you were in their place and they were in yours. It's understandable that there's a lot of people that are afraid. Fear is normal. You know, I see life through the eyes of a child as a parent, and I know what it's like, and I remember for myself what it's like that first time you step onto the high dive. You know, young people were not designed to jump off of boards into pools, and it's scary. And sometimes we go up there and we have to come back down. And sometimes we have to get daddy or mommy to go up there with us. But if we look at what is going on and we see that the lifeguards and our parents and everyone involved in the swimming pool is not lying to us, and that the high dive is not going to kill us, then the children jump off the high dive. And that's a lot of what we have to do in this situation. We have to believe in science. That what separates us from other mammals, all mammals have a fear reaction where the herd runs from things. I grew up around, in the country around animals. I've seen a herd of horses spooked by a snake and running, and that's probably a really good idea if you're a horse. I've seen a herd of horses spooked by a beer can shining in the sun, and beer cans don't really attack horses often, so there's not much reason for running from a beer can. This is more of a beer can at this point than a snake for anyone who was not exposed to the bodily fluids of Eric Duncan. So please treat these people with dignity and respect as they come back in. I'll be honest, as a parent, I'm extremely concerned for Louise's middle school son. Middle schoolers are some of the most ferocious and scary animals on the planet. And to be dropped into a pool of middle schoolers after all that he's been through, I need your help, parents. I need your help to treat that young man with the kind of love you'd want your own child treated with. I want to introduce the people that are here with me who've been part of a successful and integrated team. Of course, Mayor Mike Rawlings, who will speak next, Superintendent Mike Miles, who will also have some remarks. We've got Sherry Christian, who's the Executive Director of Student Services at DISD. And we've got George Mason. I think everybody knows George Mason by now. George is Louise's pastor, and he is one of the people that does not talk about his faith. He lives his faith, and he's living it now in service to Louise, as is the congregation at Wilshire Baptist Church. Dr. James Zaretic, who's with the Texas Department of State Health Services, where Dr. Lakey is the commissioner. Kevin Haynes, who's the federal coordinating official, who's here. I don't think y'all met before, so I'll make sure you get a chance to say hello to him. And of course, Zach Thompson, our Dallas County Health and Human Services Director. So it's a good day for 43 people. It'll be a good day a little later for a 44th, and it's getting to the end of the period for the other 4. But there's still 75 people at Presby, 25 people, mostly moms, who spent the night there last night going through the time in their lives without the benefit of a hug from their children because they are afraid they'll become symptomatic around their own children. Those healthcare heroes are tremendous people going through tremendous ordeal, and they need our help and support. We've got 2 young women who dedicated their careers to helping other people, who knew there was a risk of getting sick when you're around sick people, and who got sick, and who are fighting a brave fight at 2 healthcare facilities against Ebola. They all need our support as well. This, I believe, is a defining moment for Dallas. The world is watching Dallas, and Dallas must determine if Dallas will deal with this with grace and compassion, and have the thing that separates us from all other animals is the ability to reason and our faith. We need to be able to have reason, and we need to have faith in the facts and the science. If we can do that, then we can be a beacon for how others should deal with the sort of adversity when the next Ebola case happens here in America. So I urge you to get that message out. And here's my friend Mike Rawlings.
Thank you. Thank you, Judge. It's been an honor to work with you, and Zach, it's thank you for the county's professionalism at the city. There's no question today is a milestone day. It's a hurdle that we need to get over, but there are other hurdles to also jump. I am particularly lifted up by today because it's starting to show us the science that we talked about at the very beginning is working. When people monitor themselves, when we monitor them, we check their temperature twice a day, we can make sure that if they are sick, that we get them to the hospital quickly, and then when they're not, they can come out and be healthy. We're going to kind of walk you through just briefly where we are in this process, and then I have a couple other things to say, and if you can put this up. If everybody can be tolerant of 1 or 2 numbers either way, okay? This was numbers that were coming down this morning, final where we are, but I just wanted to give everybody a sense of where we are. So the Duncan initial contacts have been coming out this weekend and will be over the next couple of days. This is the days of incubation, a CDC mathematical model, not a predictive model, and the frequency of different cases that we've seen around the world. We are, for folks that had initial and ongoing healthcare workers that had contact with Duncan, there are about 55, 54 of those out there. And then we're going to be tracking the nurses, healthcare workers, and we're very early on in that process. As you know, she left on Thursday/Friday, and we stopped to contact the Presbyterian there. So you see the basic groups now. There are different numbers that have kind of mingled and bunched the numbers in a little bit different way, but that gives you kind of a sense. So every day that we go by here is better. We're going to be getting into some critical time with Ms. Van and Ms. Vincent's healthcare workers, and that's why we say we want to take this day by day in everything we do. So that gives you a little bit. Thank you. Thank you. The next thing I wanted to talk about was you guys. I want to say thank you. Too many people and too often criticize the media. I want to say a particular thank you to the Dallas media. You've been unbelievably responsible in getting the facts out, whether good or bad, but I think in the right level. And around the nation, thank you for the producers, thank you to the editors. Seriously, you've been part of this, and I just, as we continue to need to have that sense of responsibility. Also, as we talked about, those are named, Vincent are names, but these are human beings. These are nurses, Judge Jenkins has said this before, but I think it's extremely important that we realize that these are heroes. In the city of Dallas, I'd love this week to be Hug a Nurse Week, okay? We just need to go out there and say thank you, healthcare workers, for what you do day in and day out. And if we can't hug Nina and Amber, we can say thank you to you. And so let's lift these folks up. And lastly, look, there have been some missteps, and we've talked about those things. Dallas is strong, and the Presbyterian Hospital is strong. It has been a good hospital in this community, and it is undergoing some tough times. We are letting it breathe, and it's got an important role, as Judge Jenkins laid out this weekend, in coordination with the rest of the nation. But Presbyterian Hospital is going to come back strong as well. Lastly, it is my honor to recognize a couple of people. One group that is not here, and that is Bishop Kevin Farrell and his aide Bill Keffler. The reason Bishop Farrell is so important in this is he is the individual in the diocese, the Catholic diocese, was the individual that really came forth to house Louise and her family. We found a gated community that was a Catholic retreat area in Oak Cliff, and that's where Louise is at this time. This would not have happened. It was safe, it was private, it was safe for the rest of the neighborhood, and it really provided these last 2.5 weeks as a really respite for that family. I thank them out of the bottom of my heart for this. And if you're a member of a parish in the Catholic diocese, you guys did good and really helped our community at that moment of time. And that's what has happened with the faith-based community. They've really come forth. I'm going to introduce Nina's pastor, George Mason, who will talk a little bit about his conversations and plans for what the church is doing to get her family back on her feet. They will be working with a philanthropist that has come forward to fund a great deal of the expenses, but his church is as well. So we'll do that, and then we'll have Mr. Miles talk about what's happened in the school. George.
Thank you so much, Mike. My gratitude also to Mayor Mike Rawlings and County Judge Clay Jenkins. They have been remarkable public servants during this time. I want to reiterate also, as the mayor had said, that my experience and that of our church with all of you in the media has been quite exceptional. I appreciate very much your kindness, your consideration of all of us. This has been a really unusual circumstance, as you can imagine. We have not found ourselves in such a position before like this, and although Judge Jenkins' words about my living the faith, not talking about it, was something I think you can understand, I feel like I've talked about my faith an awful lot the past few weeks, and so I'm glad to be able to do that, but mostly to do it on behalf of our church and also Louise Troe. Louise Troe and these 3 boys who have been with her in quarantine are remarkable people. This has been a situation that's hard to even conceive if you haven't lived it. It is an isolating experience, filled with fear and anxiety about a very scary disease, and they have been able to manage this with extraordinary grace, along with the kindness of people who have written notes, who have cared for them with the health department and the CDC, government officials and the like. But people all over the country have written notes to them, have called, asked us to convey their sympathies on their behalf and to cheer them on. So today is a jubilant day for them. They are really looking forward to getting out and resuming their lives. Now, the mayor has thanked the Catholic Church, and suddenly you now know, I guess, or you will soon, exactly where they are. Okay, so one more request. They really want privacy still. It would be a tremendous gesture on your part to allow them to re-enter the community on their own terms and with some grace. Louise has asked specifically that she not do any interviews at this time. I know that you'll want to have those conversations, but she would really like to tell her story in her own way, in her own time, and there is a plan for her to do that. So I'd like to ask you to respect that, please, and to give them the grace of being able to re-enter in the way that they choose to do so. Finally, I want to say something that the judge pointed out as well. And that is, yes, there is some fear and foreboding in the community about this. I want to say that I think there's been tremendous support as well. We all have a choice in this. There is some fraying at the fabric of our community because of this. And everyone in Dallas has a choice as to whether we're going to pull on those frayed threads or we're going to begin to knit them back together. And we will decide by our behavior whether we're going to move toward these people in love and welcome and embrace them, or whether we're going to fracture even more, whether we're going to pull apart even more and make it difficult for them. I believe Dallas has risen to the occasion in this case. I believe we understand that this now is very much about who we are, not who these other people are. And so this is a test for us. We've been passing these tests for several weeks. I believe we'll pass this one too, and I urge you all to act in such a manner. Thank you very much.
Well, thank you. I just first want to say we are happy to have our kids back in our schools. 5 students will rejoin their schools on Tuesday. And we've been doing a lot of work. I want to reiterate what the others have said this morning. For all of us to be sensitive to our students. They've been through an ordeal, and I won't say much more. You've heard it already. But I think the schools will be well prepared. I want to reiterate also that our students are now cleared. And what that means is they don't have the virus. They can't give the virus. They're not contagious. They can't give it to anybody. And neither will they ever be contract Ebola, them or the other students or parents, if they don't come in contact with somebody who has the virus and is symptomatic. So our kids are clear, they're safe, they're going to rejoin our community on Tuesday. We've done a lot of preparation work for both the staff and the parents at the 5 schools, preparation for that. We're also going to continue to keep our staff and community informed. And in that light, I want to say this morning that there may be 3 other students who will join our Dallas ISD community. 3 students who were at Wallace Elementary School in the Richardson School District. We were told over the weekend, we confirmed it over the weekend, have withdrawn from Wallace Elementary School in the Richardson School District. And their intention is to enroll in Geelstone Elementary School on Tuesday. And so we are going to be preparing the Geelstone community and staff and giving them information. Now, we've provided information to all of our schools and staff members and community over the last 3 weeks. But we're doing even additional work at those schools, those communities. And so we will actually have 8 students who've all been at home for the last 21 days join us on Tuesday. And we are welcoming them. We are glad that they're back in school. That's where kids belong, and we want to integrate them as smoothly as possible.